Hi there, I'm Ginger Cochran, registered dietitian and certified diabetes care and education specialist, and we're going to go over how to check your blood sugars. So you're going to get a kit. It's going to have the glucometer, sometimes we call it the meter, a lancing device, all look a little bit different, and then you're going to get some strips. This is the expensive part, so keep this out of the sun, the snow, heat, away from everything. And always double check once you get it that the pharmacy didn't give you expired strips. That has happened. Very rare, but it has happened. To start, when you first get your glucometer, it's just going to have you set your time on there. If you have a smartphone, it's going to be really easy for you. Next up is you are going to want to put the lancet. So that is the little pricky device that is going to prick you into the lancing device. So all of them are a little bit different, but this one and many other ones, you just have a little top, you turn, and then you're gonna put this in here. So that's a little lancet that I got out of the case. And then you can see there's a little plastic top on there. All we're gonna do is twist. And there it is. Save this for later, because what you're gonna do on a flat surface, which I don't really have right here, is you're gonna prick it back in there in the little plastic and then shoot it off. Now we're gonna put the cap back on. You'll also notice that there's some numbers right here. So that's just how forceful it is. I say most people are about a 3 or 4. If you're someone that works with their hands a lot, you might be someone or like a mechanic, you might be a little bit higher. A lot of them, you have to crank back a little area to load it. Now this is all set. Next, what you're gonna do, you can either wash your hands or use an alcohol pad. Since I'm sitting on my couch, I'm gonna use an alcohol pad. And I'm gonna clean one of my fingers. So I like to prick these guys because I don't use them as often. And also these guys I use a lot, so the skin's a little bit tougher. So I'm gonna have to move that die a little bit higher to get the prick. So I'm gonna clean this with my little alcohol pad. Nice and clean. Then we're gonna take our meter and we're gonna take our strip, okay? You're gonna put the strip in. There's gonna be something that looks a little like a computer device or a chip. This one looks like piano keys, and you're gonna put it straight in the glucometer, and it's gonna turn itself on. Mine's turning itself on. And you'll notice on this strip, so you can like see it's like boop, blood here. So I see a lot of mistakes, and even I did this the first time, is that they put the blood on top of the strip. It's not gonna go anywhere. There's actually an opening on the edge, so when you prick yourself, you actually wanna go into the blood drop and it wicks it. So don't just set it on top, go to the opening on the side and wick it in. Now what we're gonna do is we're gonna prick my finger. And so what you wanna do, the needle doesn't go beyond the plastic. So you want to press on the skin. If you don't do that, you're just gonna scare yourself and you're not gonna get pricked and you're gonna have to do it again. So just press down and then press the button. And look, I didn't do it enough. So now I have to do, oh, it was set to 1, that's why. So now we do it again. Oh, see? Learning through my mistakes. Oop, definitely felt that one. Now I have a little blood drop. It doesn't have to be a lot. That isn't a ton right there. And we're just gonna go into my blood drop, and it's going to wick in. And let's see what it says. I guess it's upside down in there. And that's it. And then you're going to write that down. You're going to take your lancet out of here. A lot of them have this little thing where you're going to push this out and it's going to eject it. And then you're going to put your in a sharps container. If you don't have a sharps container, put it in another hard container. And the next time you go to the pharmacy, ask for a sharps container. When you're done with that, you can return it to the pharmacy and they will dispose of the sharps. And that's it. Pretty simple. It will get easier and easier. If you have gestational diabetes, our goal is that you check your blood sugar very first thing in the morning. Or the goal is, for most practices, according to ACOG, is for it to be under 95. Then 1 hour after you started eating a meal, the goal is for it to be under 140. If you can check at the 1 hour mark or you are a very slow eater, you could check at the 2 hour mark and the goal is for it to be under 120. If you are postpartum and wondering about those numbers, so postpartum or outside of pregnancy, the goal is fasting to be under 100 if you do not have diabetes, and 2 hours after you started eating a meal under 140. Let me know if you have any questions.